Hi, I'm Ananta Dave. I'm a consultant psychiatrist and medical director in the NHS. I'm really pleased to be sharing my thoughts with you on the occasion of South Asian History Month and talk a bit about a career in the NHS during pandemic times. I think a key component of having a successful career in the UK is about making sure, especially for international graduates or those who are starting afresh, but making sure that there is a proper induction and introduction to the NHS and the system, having the right mentors and support systems when a person joins the NHS, and fostering a sense of belonging. Just thinking back to my own experience of when I started over 27 years ago, I can still remember that it is the warmth of people and the reaching out which helped me settle in the early days. And this fostering of belonging and forming of networks and building up that social capital is really important as people go across in their careers in various grades and positions. Every doctor or nurse and indeed health professional wants to make a difference to patient care and use their clinical knowledge and skills in order to improve outcomes or improve the way people recover from mental illness. And that can be done when the people who are providing the care, that is the staff, are looked after. And we know that being looked after well as a staff member actually helps you deliver better patient care, and patients have a better experience of receiving that care. And that is something which has been strengthened by what's happened during the pandemic, the COVID-19 pandemic, over the last 18 months or so. I've seen that if we want to come out of a crisis and an extraordinary and unprecedented situation like the pandemic has been and is continuing to be, we need to look after people and come together. It's most important that people feel safe or feel able to speak out or speak up when they don't feel safe, that they are able to take part in decisions that are being made about how they are supported at work. So those cases, whether it is in the NHS or outside in other sectors of society where people have not felt able to ask for support to keep themselves safe from the infection or to be supported with the right tools at work, we've seen that there have been more instances of COVID-19 illness, hospitalizations, intensive care, and death. And this has particularly affected people from ethnic minorities, all ethnic minorities, and indeed from those from a South Asian heritage too. So the importance of clear messaging, making sure that leaders are supported to act with equity and with compassion, the importance of having rules and making sure that everybody is treated equally fairly, and also that they are allowed to say something about when things are not going right is really important. We cannot underestimate the contribution of the South Asian communities during the pandemic, as indeed people from all over the world from a wide variety of backgrounds have contributed. South Asians have been working in the front line or as key workers in many parts, in many sectors of society, whether it's healthcare, emergency crisis services, things like supermarkets, groceries, and many other frontline services like transport, the care sector, etc. So the contribution has been immense, and we cannot also forget the contribution of families, informal, unpaid carers, volunteers during the pandemic. They have kept people going, and they have enabled staff to give their attention to the work when other things have had to be taken care of by the carers and the volunteers. So it's really a huge debt of gratitude, along with a commitment to look after the key workers and the staff, that we need to renew as we move forwards onto the next phase of the pandemic. One of the other things that's become really clear during the course of COVID-19 is the fact that, especially in the NHS, we've seen there are many people coming from international backgrounds. They come from all parts of the world working in the NHS. And for many of them, they've not been able to see their families, loved ones, or friends for around 18 months or so, as COVID-19 restrictions, either in the UK or their country of origin, have made it impossible, if not difficult, to travel. And that's been the case with me as well. Like countless others, I've not been able to see my parents and my siblings and my friends over the last 18 months. I originate from India, and I have watched with horror and a sense of helplessness and agony as I've seen the COVID-19 pandemic unfold in India. So, along with what's been happening here in the UK, to know that other countries and the countries where we originate from are being equally devastated it hits very close to the heart, and it has affected my work and many other people's work. So I have been quite open in talking about how the long hours that I had to spend and the unsociable hours I had to spend contacting families, friends, doctors in India, worrying about the health of my father or other relatives who were admitted to hospital, grieving for the loss of loved ones, has been difficult. It tends to leave an emotional impact. And I think, especially for those of us working in the mental health sector, it's really important that we acknowledge the impact this can have. And indeed, many organizations have supported their staff in being able to take time out or getting the time needed to make phone calls, etc., and just be there, just to offer their emotional support and understanding at a time when it has been very difficult. I have similarly been supported at work, and I'm hugely grateful to my colleagues for that. Things are easing up now in India, and as in indeed in some other parts of the world, but it's really important that we keep in mind that people have been working far away from their families, and this can feel incredibly difficult, especially if things are opening up in the UK and people are able to meet families and friends who are more locally based. Because of the intensity of emotions which have been generated during the pandemic, the grief, loss, the suffering of many, and the difficult period of recovery, the uncertainty and the possibility that we may have to have further restrictions, that there may be further waves of COVID-19, the realization that COVID in any part of the world affects our part of the world too, all the inequalities that have been exposed due to the vaccination debate and the issues around vaccination hesitancy, all this has had an impact on people's health and well-being. For me as well, in order to continue working, look after myself and my family, I have had to find outlets outside work which I turn to regularly. And for me, connecting with nature, or indeed reconnecting with nature, and writing poetry, writing blogs. In fact, I started blog writing early this year. All these have been ways of being able to express myself, being open about how I feel in it. So I think for many others as well, whether it is a song, dance, poetry, connecting with friends, even virtually, or taking a walk, etc., have been really vital in keeping themselves going. Of course, there are also offers of support available through the NHS People's Directorate and NHS England and Improvement, and indeed in various trusts. And I have made use of those too, and I constantly encourage my colleagues to do so as well. So these are some of the thoughts that I wanted to share with you all about what it has been like for workers during the COVID-19 pandemic, and especially some of the issues which have affected those from a South Asian diaspora. Thank you.